When people injure muscles, bones, and joints, there could be broken bones, strained muscles, or sprained or dislocated joints. An injury to muscles, bones, or joints may be severe if the person cannot use the body part, heard a snap, pop, or experienced grating bones or a loss of feeling in the area. You see bone fragments, swelling, and deformity, or notice that the incident itself caused severe injury. Call 911 or the local emergency number if a muscle, bone, or joint injury appears to be severe. The general care for a muscle, bone, or joint injury involves following RICE: rest, immobilize, cold, and elevate. Rest: do not move or straighten the injured area. Immobilize: stabilize the injured part in the position it was found. Minimize movement to prevent further injury. If you need to transport the person to get medical care, splint the injured body part unless applying the splint causes more pain. Cold: apply an ice pack to reduce swelling and pain. Place a thin barrier between the ice and the person's skin. Keep ice on the injured area for about 20 minutes if tolerated. Elevate: if there is no pain, gently elevate the person's injured body part, which may help reduce swelling. Do not elevate the injured part if it causes more pain. Splinting should only be used if you need to move or transport the person to seek medical attention, and if it does not cause more pain. Two things to remember when working with splints. Apply splints to immobilize the areas above and below the injury. Do not try to straighten the body part. Instead, splint the body part in the position found. There are multiple types of splints, including anatomic, soft, sling and binder, and rigid. Anatomic splints immobilize an injured body part using an uninjured neighboring body part. Support the area above and below the site of the injury. Check beyond the injured area for feeling, warmth, and color. If the person is wearing a shoe, do not remove it. Place folded triangular bandages above and below the injured area. Move the uninjured body part next to the injured body part. Tie the bandage securely. Do not tie the ends directly over the injured area. Recheck beyond the injured area for feeling, warmth, and color to make sure the splint is not too tight. If the person loses feeling or her skin turns pale, cold, or blue, loosen the splint. Soft splints, such as folded blankets, towels, or pillows, work well to immobilize injured ankles and forearms. Support the area above and below the site of the injury. Check beyond the injured area for feeling, warmth, and color. Place folded triangular bandages above and below the injured area. Gently wrap a soft blanket or folded towel around the injured body part. Tie triangular bandages gently with knots. Tie the bandage securely. Do not tie the ends directly over the injured area. Recheck beyond the injured area for feeling, warmth, and color to make sure the splint is not too tight. A sling and binder can be used to immobilize injured arms and shoulders. Support the arm above and below the site of the injury. Check beyond the injured area for feeling, warmth, and color. Thread one end of a triangular bandage under the injured arm and over the uninjured shoulder to form a sling. Tie the ends of the sling together at the side of the person's neck. Pad the knot for comfort. Bind the injured body part to the chest with a folded triangular bandage to keep the injured area stable. Recheck beyond the injured area for feeling, warmth, and color. If the binder is too tight, loosen it. Rigid splints, such as padded boards, folded magazines, or padded metal strips that do not have any sharp edges, can be used to immobilize injured areas.
What happened?
Support the arm above and below the site of the injury.
Okay, just keep your arm steady.
Check beyond the injured area for feeling, warmth, and color. Place the rigid splint under the injured area. Immobilize the elbow as well as the forearm. Place a roller bandage in the person's hand to keep it in a natural resting position. Tie folded triangular bandages above and below the injured area. Recheck beyond the injured area for feeling, warmth, and color. If it's a forearm injury, bind the arm to the chest using folded triangular bandages or apply a sling.